And so you have these agricultural industries, you have dairy, you have the meat industries, where they are ensuring that from an economical perspective, they need to have their product in the mainstream. The problem is it's been wrong. And it's so unfair that people have been almost blamed for their problems. The reason why you're overweight is because you're lazy. You're not exercising enough. But the reality is these people can't back up what they are saying. They can't back up the attack on the plant-based movement because they don't have anything. You can't attack a movement where you are showing a reversal of atherosclerosis, a reversal of heart disease. How can you attack a movement where I am being able to switch off diabetes type 2 in my patients? You can't attack it. The idea that people can now start to take control, take the reins again in terms of their health is revitalizing. Thankfully, nowadays we have things like the internet. We have institutions like PBN. We have plant-based news. We have people out there that are helping to spread the message.
Hey guys, I hope you enjoyed that little 2-minute segment from Dr. Anthony Hadj's talk that he did in London. It was the first plant-based Seas event that we did like it. So thank you to everybody that came along. If you want to see the full talk, it'll be linked down below, so check it out. And also wanted to say in this video, before we get into the interview with Dr. Anthony Hadj, that we're doing a massive giveaway this month. We're giving away 1 bursary, 1 free ticket for somebody from the PBN audience to do the plant-based nutrition course at eCornell, headed up by T. Colin Campbell. It's worth $1,300. It's really prestigious. So if you want to do that for free, check out the other link down below and pop in your name. Anyway, I hope you enjoyed the interview with Dr. Anthony Hadj. Great to meet you. Thank you for coming to London. I really, really appreciate it.
Absolute
you are
pleasure.
from Melbourne, Australia, correct?
From Melbourne, yeah. From a very warm Melbourne, but now I've come to a very cold London.
And you're a plant-based GP.
Plant-based GP.
Since
about 3 years ago, since I went vegan 3 years ago and I started incorporating this into my own lifestyle, I recognised the value of being able to introduce it into my patients' lifestyle as well.
Can we just talk about the movement and how it's flourishing? I've noticed in the last couple of years, 3 years obviously of you as well, there's been like a new wave of physicians that now tout the benefits of plant-based nutrition. Have you noticed this explosion in the amount of information going out there?
Yeah, certainly. See, one of the key things about, say, 5-10 years ago, we didn't have the benefit of, say, the internet in its capacity to spread the information as we do today. So whilst there were certain physicians around in terms of the American side, such as Esselstyn and Bernard and T. Colin Campbell, they weren't widely known amongst, say, the UK and particularly in Australia. So when I went through all my medical training, I wasn't exposed to that. And it was only the last 3 or 4 years, as the movement slowly gained momentum, that I came across it. And the information is so difficult to contain now. So it's out there. And by actually being exposed to this, it's very, very seductive to young doctors like myself as a new form of management of our patients, which has got just wonderful benefits and very, very good results.
Let's talk about the benefits really, really quickly for people that might not be aware of the beneficial effects a plant-based diet has on human health. Yeah. What are we talking? Just a couple of the chronic diseases, or? Well,
look, certainly it's important for us to understand that the main cause of chronic disease states that we in the Western world experience, such as the type 2 diabetics, the high blood pressures, high cholesterol and vascular disease, strokes, etc., have their genesis all in the Western diet, okay? Now, yes, genetics plays a certain role, but so does the environment. The environment is the main focus here. So whilst we're having the processed foods and the Western diet contributing to it, the plant-based foods actually therefore get rid of these disease states. And so it's why it's possible for people who adopt a plant-based diet to actually reverse and rid themselves of these disease states and also prevent it from occurring.
And have you seen this with your patients? And also it might segue into my next question, which is, are you able to prescribe a plant-based diet as a GP?
Look, absolutely. One of the key features of general practice is that we try and have a holistic approach to the patient. Look, I use medication all the time because it's very, very helpful for my patients. When I want to protect them and I want to get their blood pressures down, I want to make sure that they're breathing well, I'll use inhalers or I'll use tablets when I need to. But these are always a short-term solution on the whole. What we also, as general practitioners, need to realise is that we need to adapt strategies with our patients so as to make sure that they are protected for the long term. Now, diet is one of the most important things that we as doctors can always do for our patients. The idea that we use nutrition hasn't really been explored enough over the past 20, 30 years as it has in the last couple of years, when we're now using plant-based diets. And really what we're talking about here is very simple. We're telling our patients, or instructing our patients, when you go to the supermarket, just ignore the animal products. Go and fill up on the fresh fruit, the vegetables. That's all we're doing. We're sending our patients to the healthy part of the supermarket. We're giving them free range in terms of what they can choose, and of course how much they want to collect and take home with them. And it's one of the easy aspects of my job, simply telling people that that's all they have to do. And the results speak for themselves. People rid themselves of blood pressure tablets, they rid themselves of joint and muscle aches, they lose weight, they feel fantastic.
So if that's the case, and these beneficial effects happen to most people when they go on a plant-based diet, why isn't this information more widely known, and why do doctors not recommend a plant-based diet? Look,
most doctors don't probably see its power, to be honest with you. I'm very supportive of my profession. Now, look, when I went through medicine for 6-7 years back in the early 2000s, I was really deep in textbooks and online resources. That meant that I came out with a lot of scientific knowledge. Nutrition didn't form a large part of my training, but it couldn't actually at the time, because there was so much information that we had to learn. Nowadays, the medical students that are going through training programs have even got more information to learn. So nutrition is a very, very underutilized but under-recognized form of practice. So our hope, I suppose, is that as we get more and more people out there, such as myself and other doctors, promoting this way of life, we will start to see nutrition creep into the medical curriculum in a bit more of a stronger way.
But even if it does creep into the curriculum, is that really going to make a difference? You look at dietetics courses and dietitians, they get 2-3 years of nutrition training, and their advice is just as useless as most people's, in terms of the way it's watered down.
Well, look, it's watered down, absolutely it is, and it's also influenced. It's influenced by the dairy industry. It's influenced by certain foundations that would have a prominence of support from the meat industry.
What do you mean by that?
Well, yeah, absolutely.
Most people probably hear that and think that sounds really conspiratorial.
No, look, it's not. There is a website back in Melbourne that we sometimes direct people to go to. It's called betterhealth.org or something. And it has generally very, very good information. But then there are certain aspects of the information regarding, say, chronic health issues, such as high cholesterol, high blood pressure, and obesity. And when they give dietary recommendations, down the bottom of it, it says we thank the support of the dairy industry of Australia for their information. And you go to the Dietetics Association of Australia, for example, go to their website and you see similar kind of guidelines, but then down in the fine print, they say with thanks to the dairy industry or with thanks to Animal Agriculture Australia. It's there.
There's a conflict of interest.
There's a conflict of interest, yeah. And certainly we now see that creeping in more and more and more in a clandestine way. But thankfully, people are recognising that it doesn't work. If we've been following these guidelines for so many years, why have we still got the patients that are still so unwell? Why aren't they getting better? Why aren't their diabetes being well controlled? And the reality is it's not. So we must be doing something wrong. And the reality is we haven't grasped the power of nutrition as much as we should have by now.
We talked quickly there about the barriers holding the plant-based movement back with the industry influence. Can you talk about the effect of the kind of low-carb message? Is that a major barrier?
Yeah, look, it is, because you see, the low-carb message is the new kid on the block. And the new kid on the block is a new student to the class every semester, and they just give it a different name. And so whether it's going to be Paleo, whether it be South Beach, whether it's going to be Atkins, it can be renamed, and every month it'll be renamed, and there'll be a new person who'll say, no, my idea is better, and I've got the right idea now. But the essential elements of a low-carb, high-fat, high-protein diet are one of starvation for the body. It puts the body under enormous stress, people do lose weight. Now, we understand the science behind it. And Atkins once told McDougall in an interview that they understood why people lost weight. But even Atkins himself couldn't actually explain coherently why it was beneficial. And then McDougall talks about why it's not beneficial. You can't strain the body like that in an attempt to lose weight. The body will never ever allow you to get away with it. It will fight back. And not only are you putting yourself into a very, very, very stressful situation internally, but your body will make sure you regain that weight, and you often flip over where you were from the start. So these kind of movements are very seductive and influential because they offer a very quick fix, okay? Whereas the plant-based approach offers a much more fortified and reliable approach to regaining your sense of health. Your body will lose weight, your body will reverse these disease states, but we need to use the healing process that's within every single cell and let the body heal itself naturally. Let's not force it. And that's the problem with these low-carb diets. But there'll always be a new one on the block tomorrow.
Do you think the people that recommend them, the high-profile people, like the people that sell books and the doctors, do you think like they're just sort of misinformed and they're a bit confused about things? Or would you say in certain cases there's a lack of integrity?
Oh, look, a bit of 50-50 maybe. I mean, look, it's hard to say because often the people who are promoting this fall into quite a similar demographic. They're often young, they're very attractive, and they're very, very good at being able to market themselves. And they fall into that category, and it appeals to people. Now, when you're young and you might be in your early 20s and you're female and you can wear a bikini and you can look nice, then yes, people are going to look at you and gravitate towards you and say, that's how I want to be. So you can really sell anything. When you press these people and you ask them, okay, why does your way of eating, why does your way of promotion work? They can't answer it. They will make some kind of excuse. Oh, well, you lose weight because you exercise and you're restricting your calories. But scientifically, that doesn't make sense. That leads to starvation. So they don't actually believe, I think, that they are on a true winner when it comes to scientifically. They do see financially the gains of it. But these movements don't work. I see so many patients that will go on the paleo diet or they'll go on the bikini model diets. And I'm not talking about one particular, I'm just talking about, we know so many examples. The general culture, that's right. And they'll come to see me and they'll say, I'm so fatigued, I'm run down. I tried to do this for my best friend's wedding to lose weight, and I did lose weight, but then I felt awful and I felt sick ever since. And we put them back on those high carb, the whole foods diets, and they revitalize. So I don't believe that there's so much so that they are doing it from potentially a bad way, these low carb movements, but they probably don't understand the damage that they're doing.
Mm-hmm. Last couple of questions. If you put yourself in your shoes when you were first starting medical school, what was the one thing that you wish you knew then that you didn't?
That's a great question. I suppose I wish I knew just how powerful plant-based health was. When we were taught medicine and we were taught, conditions, and we were always taught, the science behind them, and we were told these are the medications that you use, and this is the outcome, this is how you introduce it into patients' lives. Diet was never mentioned, and that wasn't because of any big conspiracy, it's just that it was never ever recognized. Traditionally in Western medicine, I think we're very good at the acute medicine. In emergency, for example, we're very, very good at being able to do surgery, to be able to reverse things quickly. The focus of Western medicine now needs to really change. It needs to go towards this idea of holistic health. But also incorporating science. We can't be gurus and living off in fairyland, drinking juices every day and saying this is going to be fantastic. We do need to use modern medicine, but I think we need to push ourselves into the realm of holistic health, and diet would be the key thing. And so I do wish that I'd been aware of what I do know now, because I certainly could have used that. And even more selfishly, I could have even used it for myself, and that would have been fantastic.
Mm-hmm. Last question, what really gives you hope for the movement? Obviously, we talked in this interview about the explosion in the number of plant-based doctors. What's the kind of trajectory that you envisage?
It's all positive. It's all great. It's all positive because people like yourself and others are getting out there, you're helping spread the message. And, at the heart of most people is the idea of wanting to do good. And when you come across a movement like this, where people can achieve such a wonderful outcome, not only for themselves, but for the world, for the animals, those gorgeous souls that live with us on this planet, it's extremely attractive to go down that pathway. And I can't foresee any reason why this isn't just going to grow exponentially. One of the key things here always to appreciate is it just takes time, okay? We are seeing an explosion, not only in the medical fraternity, but also in the ethical and environmental arguments towards veganism. And that's what gives me hope. That's what gives me hope. You know, if you don't want to go vegan for health reasons, and you want to go vegan for ethical reasons or economical reasons, that's fine. Because we know that the benefits of going down that pathway from a health perspective are going to be nothing but 100% right.
Great. It's been great chatting with you.
Thanks.
Where can people find out more about you and what you do?
I have a website. It's called livinglongertoday.com. The idea behind that website was that I would just put up a lot of information that I've had floating around in my head for the last year or two. Because when I see a patient, I can just sort of spend half an hour, 45 minutes with them. And I figured, well, why not try and put that information up on the website? It's all free. There's a health guide that I've designed. It's a PDF document of about 10 pages that can be downloaded. And there's some links to videos and interviews that I've done with some other health practitioners. I'm not selling anything, and I'm not certainly going to be strutting around in a bikini and trying to make people buy my books. It's all free. It's all there. The information is out there, and I wish people luck.